superior or inferior, just along that same line of the psoas. And then, as we did with the iliacus, we would either passively lower the leg or have your client actively lower the leg. If they are willing, I have the client actively lower the leg. That makes the process go faster. They have to be willing to do that and be involved. And then slowly bring that knee up. This can be quite intense. The psoas muscle actually is involved with the constant movement of walking, and the flexing of the psoas muscle has a good effect on digestion. Many times those who have painful menstrual cycles will find that a release of the psoas will greatly reduce that pain that they have each time they go through the monthly cycle, because that contracted psoas is literally preventing the kind of cleansing and purging that the body needs. So again, we will move up. This is the position of comfort. So we start in that position, or you could start with the leg down, but very often, because this is an emotional, painful release, that will be too much to start with. I will have the client bring the leg up and actually begin in that position of comfort. But the actual movement then is down and back up, either passively or actively. We'll finish there, and we'll have a 20% effort. That resets the proprioception. Now the final stage here, and I'll actually use this side of the body to demonstrate. I'll have Joe slide right over to the edge of the table, and I'm going to give him a border. He's going to run right into my hand. Good, good. And what we're going to do is we're going to let this leg drop and let gravity help us stretch out this psoas. Okay? And that stretch can easily be a 60 or 90-second stretch. Very beneficial to the entire abdominal health of the body. And again, we would then tap, ask for a slight contraction to reset the proprioception in this new resting length. Trigger points are a contraction of the muscle. Once you remove the trigger point and you have lengthened the muscle, that new resting length then has to be reset by that tense and relax isometric that wakes up the spindle cell, and we have a good reset of that proprioception. So that is how we will release trigger points in the iliacus and in the psoas in our final stretch position, which many times will release long-standing chronic back pain. It's deceptive. It's a hip flexor, but the anchor is all the lumbar vertebra. And this, along with, as Diane mentioned, the quadratus lumborum, those two back muscles are chronic in many people, sources of pain, and this will be probably the most intense release that you can choose to do. And so it must be done patiently with the client's permission. And again, keep in mind with the knee flex is the position of comfort, and you will want to respect your client's tolerance and limits when you do this release. The isolations for the pectoralis major will be similar to those other muscles that had a large, broad origin, and then of course the more focused insertion. So with the sternal attachments, the clavicular attachments, and attachments at the intercostal area, we will then go to the insertion, which is more focused, and this muscle actually turns to where there's a flip and it inserts into the humerus. And looking at that insertion, we'll see some different lines of pull here. With the arm in this position, then the pull in a straight line will be more of the sternal fibers. Okay? And if you look at your ACB or your giant muscle map, you can see how those fibers are oriented. If we bring the arm to the middle, then we would be working directly to the sternum there. And as we bring the arm down, the straight line would be to the clavicular fibers. Okay? So, a position of comfort where we're working here would be bringing the arm across. If it were in the sternal fibers, it would be bringing the arm down. If it were more in the midline, then it would be bringing the arm across the body. But it's always helped me to go to the insertion and then see how it broadens as it goes to the origins. So, position of comfort will be in one of 3 positions depending on the fiber's attachment. Okay? The extended position will also be here if it were a sternal trigger point. And again, I would ask for a 20% effort, and you can feel that flex. If it were more towards the midline, would be the 20% effort, would reset that proprioception, and you would flex in this position. And again, you can visualize that straighter line of the muscle fibers, and that is how you determine what your isolation will be. Now we're going to work in the lower part of the arm, and this is an area of, well, today's keyboarding kind of lifestyle and constant kind of repetitive motion and factory work. The forearms and the wrist, the carpal tunnel syndrome is something that you will see a lot. I have worked with many people that had the brace because they had been to the doctor, and the doctor said, you know, you've got to restrict that movement. They had been recommended that if there was no improvement, there should be surgery. And literally in 10 to 15 minutes, they could take the brace off and move the thumb, whatever the affected part was. And it's one of the most impressive things that you can do for your client, and is one of the major reasons why I say doing trigger point work can really make your practice. It will develop your reputation. Chronic pain is very debilitating. It is depressing when you think there is no possibility of relief except an operation, and even then, a matter of years later, they will have the same symptoms again many times. If you can remove that pain, you will have a very loyal clientele. Okay, in the forearm and in the upper arm, you're going to see the same kind of similarity that we had to the knee, a hinge joint, and in the ankle you had tarsals. Here we have carpals, very similar. A little bit of a rotational component, and we will do the same kind of isolations that we did there. So, for instance, one of your interesting and powerful places to work is the brachioradialis. It actually starts above the elbow and continues down below the wrist. Okay? So if I were to work that area, you will very often find trigger points. You would use your pain scale, and then I would have Joe, and most of the time I try and do this actively. If it were super painful, then I would do the passive. But Joe, I'd like you to take your hand and just flex that hand up and down. Good. Now a little rotation to that. Good. Remember, if it isn't in direct isolation, that rotation still will coordinate the groups of muscles. And now I want you to add the fingers to that. Just kind of wiggle those around. You can do that kind of individually if you wanted to stop and flex that a little bit, or combine it with the other movements. Okay. Now in your ACB, you will see that there are carpi muscles and digiti muscles. Carpi means it goes to the hand but does not extend to the fingers. The digiti means that the fingers will be involved. So if you see an extensor carpi muscle, then you know it's going to extend the hand this way. A flexor carpi is going to flex the hand that way. So that's just a matter of getting your direction straight. But when you work any of these muscles, you're going to have the same basic isolation. If it were an extensor, you will work it this way, but of course if it's a flexor, you're still going to work it that way and add the rotation component. And for some of these muscles, you will also add the fingers, because even again, if it isn't a direct isolation, it will work to coordinate these muscles and have them work together. Okay? So again, the structure determines the form of these muscles. And we'll move up, now above the elbow, and of course bicep meaning 2 heads, triceps meaning 3 heads, okay? And we have that same kind of hinge joint that we had at the knee. So that is going to be fairly simple to predict. When you find a trigger in the bicep, then you're going to flex and extend. Okay? And I, again, try and do this actively because it goes so much faster. But if it were to be very painful, then I would do the position of comfort, which is, again, the same position as flexion, but it's done passively. Then when I want to reset proprioception, I would say give me 20% effort and reset the muscle in this lengthened position. Tricep, of course, is the antagonist to the bicep. So if we place the arm here, we can see that when we tap here, the tricep flexes. This would be the position of comfort, which is that slackened position when it's done passively. The extended position is here. And when I want to reset, I would ask for a 20% effort. That resets the proprioception there. Okay? So a mirror image of what happened with the lower legs and the calves. Because of the similarity of the joint structure, you're going to see those same simple isolations in the arms. Okay? Thank you, Joe. Thank you. The next area we're going to work is the TMJ temporal mandibular joint area. And we're just going to do this in general. There will be a more detailed video to follow. But what we want to do is just show you a couple of simple isolations. And they are active again. And we're going to do the masseter. And that is, according to some people, the most powerful muscle in the body. And you can easily feel this on yourself. In fact, I want you to do this. Clench your teeth. And when you do that, the muscle that you feel flexing is the masseter. Okay? And so what you'll do is you'll apply a little bit of pressure and then have your client just gently open and close the jaw. And again, you have to be very observant and sensitive to how your client reacts to this. They may even have a little panicky expression or reaction, and so you will want to pay close attention. Thank you, Joe. And you can apply more pressure as that muscle starts to soften. This is a very good place to do self-applied massage. We talked about the work with the trapezius and the sternocleidomastoid. The masseter is another one of those muscles that it's very good for you to feel both the pain and the relief, the release that your client is going to feel. And so in my classes, I insist that students are aggressively doing self-applied massage. You need to know that it hurts. You need to know what kind of reaction you have. And the second muscle that we're going to do is going to be right alongside the ear. These are the pterygoid muscles. There are actually two, one here, one right at the bend of the jaw. And this is even more sensitive in many cases than the masseter was. It's a smaller muscle. And again, have your client open and close. And many times you'll hear the clicking, but you have to be careful not to overdo it. And for a little bit of resistance, if you want to reset the proprioception, then you can actually give them a little resistance as they are closing and opening. That will give you some of that same proprioceptive resetting that we had. Okay. And then following along to the angle of the mandible is the medial pterygoid. This was the lateral and the medial. And again, be observant, be sensitive to how your client reacts, and move that jaw up and down. And many times, just in those few minutes, the clicking that they've had for a long time will either be greatly reduced or removed. But it is not an easy place to work. It's emotionally upsetting sometimes. It has kind of a panicky feel to it. Really anything involving the face and the neck, because those are highly guarded areas. But that is the very reason why they retain a lot of that emotional tension. And so we can, again, do the kind of work and the kind of releases that no one else is able to do, working directly with the soft tissue and working with these trigger points.
Remember, even as you survey other modalities, the most powerful therapeutic tools that you will learn in this program are trigger points and the INIT protocol. These techniques need to be constantly practiced throughout the remainder of the class. You will learn other complementary techniques, but trigger point work will be the foundation that will create positive therapeutic change in your clients. We'd like to thank Dave Maggart, our advanced class instructor, for his valuable input and time. And again, Joe, thank you so much for being so generous with your time and lending us your body for demonstration.